Welcome to Echo No More, clear, credible, court-ready documentation in high-conflict parenting. No hype, no legal jargon, no drama. I'm Dr. James. If you're new here, I'm really glad you found this space. This podcast is for protective parents navigating high-conflict custody situations, especially when the other parent is manipulative, emotionally unsafe, or unpredictable. I'm not a lawyer, and this podcast isn't legal advice. What I am is a parent who has lived through this system, and someone whose attorneys over and over again told me the same thing. Your documentation is excellent. They told me it made their job easier. They told me it protected my credibility. And they told me it changed how my case was received. That's why I'm sharing this. Not to teach you how to fight, but how to document calmly, clearly, and in a way courts actually understand. This is parent to parent, calm, grounded, and focused on protecting your child without losing yourself. Medical and therapy records feel incredibly powerful to parents, and honestly, for good reason. They come from professionals, they use formal language, they often validate concerns parents have been carrying alone for months or even years. Sometimes parents finally feel seen when a therapist documents anxiety, a pediatrician notes behavioral concerns, a provider observes emotional distress, or a specialist recognizes patterns the parent has been trying to explain for a very long time. So it makes complete sense that parents want to use these records to strengthen their case, especially in high-conflict situations where parents feel dismissed, unheard, or constantly questioned. But here's the hard truth most parents are never taught. Medical and therapy records can either strengthen your credibility quietly or weaken it quietly, depending on how they're used. And that distinction matters enormously because many parents unintentionally create problems, not because their concerns are invalid, but because they misunderstand how courts interpret professional records. So, today we're going to slow this down carefully. We'll talk about what records actually do in court, what makes them helpful, what causes courts to become cautious, common mistakes parents make without realizing it, and how to approach medical and therapy documentation in ways that protect both your case and your child. And I want to say something important upfront here. This episode is not about teaching parents how to build a case. It's about helping parents avoid credibility damage that often happens accidentally, because discernment matters more in court than intensity, and the parents' courts tend to trust more are not the ones presenting the most dramatic records. They are usually the ones presenting the clearest, most grounded, most proportionate picture. So let's start with one of the biggest misconceptions parents have. If a professional wrote it down, the court will automatically treat it as fact. Not necessarily. Courts do not treat therapy notes, medical records, or evaluations as verdicts. They treat them as context. That means those records are considered alongside testimony, behavioral patterns, school information, communication records, timelines, observations, and the overall credibility of the people involved. Professional records matter, but they do not exist above everything else. And understanding this changes how we as parents should approach documentation entirely. Records tend to help most when they corroborate patterns already being documented, reflect direct observations, stay clinically grounded, remain consistent over time, and stay within the provider's scope of expertise. For example, a pediatrician documenting repeated stress-related stomach aches over time may support broader concerns about chronic stress. A therapist documenting emotional dysregulation observed consistently across sessions may strengthen an overall behavioral picture. Those records align with observable patterns. That matters. But courts become more cautious. Records speculate, overreach, assign motives, diagnose outside expertise, or appear driven by litigation rather than treatment. And parents are often surprised by how carefully courts evaluate the source of information inside records. Because courts ask, how did this information get into the record? That question matters enormously. There is a difference between direct provider observation and second-hand parent reporting. If a therapist directly observes anxiety symptoms in session, that generally carries more weight. If the therapist is simply summarizing what one parent reported, courts read that differently. Not because parents are lying, but because courts understand that all reporting contains perspective. This is one reason why emotional intensity can sometimes unintentionally weaken records. When providers receive long narratives, excessive speculation, legal theories, motive assumptions, or repeated attempts to frame the other parent psychologically, those details may still end up reflected in the chart indirectly. And once they do, they can shift how the record feels overall. Not always dramatically, but subtly. Courts notice tone, and records that feel advocacy-driven instead of clinically grounded can create skepticism parents never intended. One of the most common mistakes parents make is believing they need to fully explain the entire family system to every provider, especially when they're scared. Parents think, if I don't explain everything, the provider won't understand how serious this is. But providers are not investigators, they are clinicians. Their role is to assess and support treatment, not determine custody outcomes or assign blame. And this distinction, honestly, is incredibly important. Because when parents flood providers with lengthy narratives, screenshots, speculations, personality theories, accusations, or legal framing, providers often summarize the information instead of documenting it in detail. And summaries can lose nuance very quickly. A parent may believe they carefully explained a complicated situation, but what appears in the record may simply read, "Matter reports concerns regarding father's emotional behavior." That summary may feel frustratingly incomplete to the parent, but providers are not creating legal narratives. They are documenting clinically relevant information. And honestly, the more emotionally charged or legally framed the information becomes, the more cautious providers often become internally. Because most ethical providers understand the risks of becoming pulled into litigation dynamics. This is especially important with therapy. Therapy is designed for healing, not evidence collection. And when therapy becomes overly litigation-focused, it can compromise the therapeutic relationship itself. Children need therapy to remain emotionally safe, not to feel like every session is being filtered through court strategy. And courts are often extremely sensitive to this issue. Judges notice when children appear over-involved in adult conflict, when therapy language sounds rehearsed, when records appear litigation-oriented, and when providers are being used as surrogate advocates. And parents often do not realize how quickly this can shift perceptions. The safest approach is usually concise information, factual observations, treatment-relevant concerns, and emotional restraint. Not because your concerns are unimportant, but because clarity tends to read as credibility, and emotional over-explaining often creates unnecessary risk. Another issue parents frequently misunderstand is scope. Every professional has limits to their role. Therapists treat emotional and mental health. Doctors treat physical health. Educational professionals address school functioning. None of those roles automatically include determining custody outcomes, parental fitness, abuse findings, or legal conclusions. And when records drift beyond the provider's scope, courts often become cautious. For example, a therapist documenting anxiety symptoms, emotional regulation and dysregulation, attachment struggles, emotional distress, or coping difficulties is generally functioning within scope. A therapist declaring this parent is causing alienation or the child should live primarily with one parent moves into territory courts may scrutinize heavily. Because providers are not custody evaluators unless specifically appointed and trained for that purpose. And parents sometimes unintentionally encourage providers into overreach because they're desperate for validation. I get that. That desperation is absolutely understandable. But courts are usually far more persuaded by grounded restraint than dramatic conclusions. And here's something parents often misunderstand. A restrained provider can actually appear more credible. A therapist who says, "I observed increased anxiety symptoms over 6 months," often carries more weight than someone making sweeping claims far outside their role. Because careful language reads as professional, and courts notice professionalism. Another major mistake parents make is believing there's probably one note somewhere that proves everything. Usually, there isn't. Court cases are rarely decided by one dramatic sentence. What matters far more is alignment. When therapy notes, medical observations, school information, behavior patterns, timelines, and documentation all point in the same general direction, that creates credibility. Not because any single piece wins, but because the overall picture becomes more coherent. And coherence matters enormously in court. This is also why sudden changes in documentation tone can create problems. Sometimes, parents receive a diagnosis or validating note, and suddenly all documentation becomes more emotional, more accusatory, more intense, more certain. Courts notice those shifts. Consistency matters more than emotional confirmation. And something else parents rarely anticipate is privacy risk. More disclosure is not always smarter. Releasing entire therapy files when only one narrow issue is relevant can expose unrelated information, create confusion, complicate issues unnecessarily, or introduce material that distracts from the core concerns. Thoughtful selectivity is not hiding anything, it is discernment. Courts often respond better to parents who appear measured, intentional, restrained, and focused than parents who overwhelm the court with excessive emotional material. Because excessive disclosure can sometimes read as impulsivity rather than credibility. And I want to emphasize something important here. Your child's healing matters more than any individual record, always. If therapy is helping your child emotionally, that matters even if it does not create strong evidence. Children should never feel like their healing spaces exist primarily for court purposes, because your child is not evidence. They are a human being navigating stress, attachment, identity, and emotional development, and courts often notice when parents preserve that distinction. The parents whose documentation tends to hold up best are usually not the parents relying heavily on dramatic records. They are the parents who document consistently, stay factual, avoid overinterpreting, understand professional boundaries, and let records quietly support patterns already being shown elsewhere. They do not expect providers to prove their case. They understand that professional records are supporting context, not the entire argument. And importantly, they tend to show emotional restraint. Not emotional suppression, restraint. That means avoiding exaggeration, avoiding certainty beyond evidence, avoiding legal coaching language, and avoiding turning every interaction into a documentation opportunity. Because courts are evaluating more than facts, they are evaluating your judgment. And discernment often communicates stronger parental judgment than emotional intensity over will. I want to leave you with this reassurance now. You do not need perfect records. You do not need dramatic notes. You do not need providers saying exactly the right thing. You do not need every concern formally validated. What matters more is clarity, consistency, alignment, proportionality, and restraint. Medical and therapy records are not weapons, they are context. Used carefully, they can add depth and credibility without creating unnecessary risk. Used impulsively, they can complicate things in ways parents never intended. And above all else, your child's healing comes first, always. If something genuinely helps your child but does not help your case, it is still worth doing, because your child is not a case file. They are a person, and when parents protect that distinction, courts often see something very important: discernment. And discernment tends to read as credibility. Before we close, I want to remind you of something important. You don't need to document everything, you don't need to be perfect, and you don't need to convince anyone with emotion. Calm documentation is power. If this episode helped you, you will find a full structured system in my guide, Clear, Credible, Court Ready. It's designed to support, not replace, your attorney. And if you want help turning everything you're documenting into something organized and usable, you can visit www.economocoaching.org to download my guide on how to create a clear, court-ready documentation binder. Take what helps, leave what doesn't, and most of all, take care of yourself. I'll see you next week.